We are fighting for no layoffs for 42 nurses with Kaiser between Petaluma and San Rafael. And I got a layoff notice last Friday, and it basically says you have 60 days. After working for Kaiser for 27 years, I am angry, I am upset. I have to take care of my family. So I'm like, I cannot believe they're laying off nurses just like that.
Kaiser made $12.9 billion. It's a record profit for them in 2024, and they are already on track to do the same this year.
You have probably been hearing a lot of news about healthcare workers that have been getting laid off. And the reason why I chose to make the video on this specific topic is because nurses are actually really being affected now. The last big news that we heard, there are about 42 positions, I think now it's 41 positions in an outpatient setting of Kaiser nurses that are going to be getting laid off. And I've made videos in the past about how important it is to work for a nurses union. And if you don't know what a nurses union is, let me just explain. So let's say you work for an organization, a private institution that hires you. Let's say it's a clinic, and this clinic doesn't have a union that backs you up when something comes about. So like, let's say you make a medication error, or let's say you're trying to negotiate a higher wage, or you want to request time off, but your employer never gives you this time off. Well, when you have a union, they've negotiated all of these things beforehand. So for example, all of the hospitals that I've worked in had nurses unions. And in that, they give you a nurses union contract or a collective bargaining agreement. This is an agreement that the nurses union or the nurses within that union made with the institution or the hospital. And in that agreement, you have things like paid time off, night shift differential, evening shift differential, weekend differential, bereavement leave, CEU reimbursement, continuing education credits, and any type of reimbursement that's required if you want to go back to school. There is health insurance or dental insurance. There's retirement benefits that are included in there, whether you have a 401k or you just have a pension. All of those things are negotiated by the nurses union. Whereas if you apply for a job as a private individual and you don't have a nurses union, you have to rely on yourself to negotiate some of these things like your salary. Although, if you do want a higher salary, that's not gonna happen because you have to agree to the terms that the nurses union has already put in place with the institution. So as an example, let's say I work at a hospital like Kaiser Permanente. My salary is at the moment at somewhere around $110 an hour. And I work for Kaiser Permanente. I'm a registered nurse. I work as an ER nurse, and I've got about going on 13 years of experience actually. Monica, on the other hand, she's a per diem nurse, and she makes $142 an hour, just about. She's a night shift nurse. She works in a telemetry floor, and we both work for Kaiser Permanente. We just work in different facilities, right? Because Kaiser Permanente has over 26 acute care facilities in Northern California. This is just Northern California, but it's spread across multiple different areas. And again, one of them is Northern California. There's Southern California. There's Colorado. There's Georgia. There's Hawaii, Oregon, and Seattle, and Washington. Right? So it's all over the western states in the U.S. and some states in the Midwest and in the East Coast. Just one state in the East Coast, I believe, or a few states. But when I want to work for an organization like Kaiser and I'm working for part of the organization that has union representation, then that means when I accept a job offer, I'm also agreeing to the salary that has already been set by the union. That's just one element. Like, there's so many other things. There's things like health insurance. When you work for an organization that has a union, in a lot of cases, especially like, let's say Kaiser, I worked at New York Presbyterian, I worked at Sutter at Roseville. A lot of these organizations, when the unions worked on solidifying a contract, they asked the institution to make sure that nurses didn't have to pay an arm and a leg for health insurance. However, when we get health insurance, if you opt in for the cheapest health insurance, that means you're going to be tied to the organization you're working for. So in my case, I work for Kaiser Permanente. That means that my insurance is tied to Kaiser Permanente. So when I want to seek healthcare, that is the organization that I'm going to get my healthcare from. And when I worked at Sutter, that was the same thing with Sutter. However, there are many hospitals where they do have nurses unions. And if you opt for the health insurance that they provide, which is the lowest option, they may have Blue Cross Blue Shield, United Healthcare, Aetna, whatever the case may be, which means you might be able to seek care in a hospital other than the one that you work for. And I should also mention that for many of these organizations, if you are part of a union, then they make sure that they bake in the cost of the health insurance and all these benefits into what you pay in union dues. For example, my union dues cover all of these things, and I only have to pay about $78 to $80 every 2 weeks to get all of these things. And that includes my sick leave, paid time off for vacation, holiday pay, tuition reimbursement, and all of those things are baked into the $78 to $80 every 2 weeks that we pay, which is why I'm a huge proponent of nurses unions. And when there is something like what's going on right now, such as nurses being laid off, the union will do whatever they can to make sure that the nurses are moved from that position that has been eliminated to a position that is available within the organization. And that is what's happening right now with Kaiser Permanente. There are 42 positions that are being laid off. And most of these positions, actually all of them, are in an outpatient setting. Maternity health is one of them. I don't remember them off the top of my head. But basically these are positions where the reason why we have these services is so that we can prevent these patients from getting ill enough to end up getting hospitalized or having to go to the emergency department to seek care. That's one element of it. And you know what a lot of organizations are trying to do right now is get rid of positions that could be replaced by telehealth, telemedicine. For example, let's say somebody needs to ask the doctor a question about a specific, symptom they're having. Instead of them having to go to the outpatient clinic to do this, they could just speak to their doctor over Zoom. That's just an example. But a lot of nurses feel that these positions being eliminated would mean that the human element to care is going to disappear. And there was a nurse that I saw who mentioned this. You can't check for fetal heart tones over the phone. You can't do this on video. You can't do certain things over the phone. And that's what's gotten a lot of these nurses upset over this. But the fact that these nurses are being laid off after working for an organization for, in some cases, decades, that's what really hurts. But on the bright side, even though these nurses are being laid off, the organization has mentioned that there are over 200 other positions available in locations that are near the clinic that's being shut down. And these nurses will be able to apply to positions and get hired in these positions. If this were a non-unionized hospital and the nurses who were being laid off had no backing from a union, the story would be different. Because these nurses would have to come together in protest to make sure that their positions are not 100% eliminated to the point where they're no longer employed. They would have to do that individually and collectively without union representation. And the reason that a lot of these employers are giving for laying off their employees is that they are trying to rebalance the budget. That's a term you guys are going to hear a lot. They're trying to rebalance the budget because during the pandemic, apparently, a lot of these hospitals and a lot of these facilities were getting a lot of funding to fight COVID, to make sure everyone was either vaccinated or to make sure that the patients who were coming into the hospital being diagnosed with COVID were being treated whether they had insurance or not. Because one thing you got to remember is that when people were coming to the hospital during COVID, many of them were becoming critically ill. And this is not whether COVID is real or COVID is fake debate, okay? Because I'm a science guy, okay? So don't come at me in the comments saying that COVID is not real, okay? That's all I'm gonna say. But there was an influx of patients who were coming into the hospital with a positive diagnosis of COVID, and a lot of them were actually dying. Many of them didn't even have health insurance, and some of them, many of them have Medicaid. So when these type of patients were coming into the hospital, there had to be a way for hospitals to stay afloat if they chose to treat these patients. Otherwise, they would all go bankrupt. So during COVID, the federal government gave them a lot of funding, and they lived off that funding as if it was never going to end. And that's the problem, because when that funding dried up, a lot of hospitals realized that they had no revenue coming in or not enough revenue coming in to offset the cost of everything else, like operational expenses and all those other things that they have to pay for. That's why you're hearing now across the country that a lot of hospitals are trying to rebalance the budget or they're having to shut their doors altogether. And I made a video about this recently because this new big beautiful bill that was just recently passed is cutting Medicaid funding. And if that does happen, and it is going to happen, a lot of these hospitals rely on Medicaid to keep the doors open. And if they are not getting reimbursed, if you think these layoffs are bad, it's only going to get worse. And it sucks when you have institutions that are making insane profits, but they're still choosing to lay off workers. And Kaiser Permanente is one of them. However, if you look at their profit and loss statement, you will see that they only made, I believe it's 500 million in revenue through their health insurance program. However, the rest was made through an acquisition that they made in the last 2 years. Overall, their net profit for 2024 is close to $13 billion. So you would think that an organization that has made so much money can refrain themselves from laying off employees. But in this day and age, with AI coming into play and technology, I mean, if you look, there's a new headline that I just recently read about Epic and how their newest update is going to use AI in a lot of aspects of their electronic charting system. And this is just one element of healthcare. AI is going to play a huge role in a lot of our daily lives and in a lot of our workplaces. We need to learn how to adapt to it. And what I always tell nurses is, in moments like this, we should have been ready. We should be prepared for something like this. This is why I tell all of you, do not live as if you have more paychecks waiting for you at the end of the week. You have to live as if this is your last paycheck. And every single paycheck you receive, you need to start putting money away. You need to start saving a percentage. You need to start investing a percentage, because saving is not just it. Like, you can't be just saving these days, because inflation is just going to eat up all of your savings. So you need to mix that with a lot of investing. And the stock market has been doing well for a lot of people over the last year or so. So if you invest your money, just put it in an index fund. You don't have to be super complicated about that. You don't have to be doing option trading. You don't have to be investing in things you don't understand. Read about index fund investing and just put your money in a few index funds and put it on autopilot. Then you don't have to think about it for the rest of your life. So when an event like this occurs in the future, you're going to be ready for it. I don't know. What are your thoughts? What do you guys think about this? What do you think is the future of nursing? Because this is only the beginning. And there are going to be a lot of organizations that you're going to hear about that are going to be eliminating certain positions because they just don't make any financial sense anymore. And at the end of the day, a company is not going to keep a position open that is not going to be profitable for them. It just makes no sense to do that. What do you guys think? Let me know. And if you want me to talk about a certain topic, I'm on my way to work right now. I need to find time to make these videos because I barely have time when I'm at home. I just came back from a vacation. We went to Curacao and then we went to New York for a day. In 2 weeks, we're gonna be leaving to Oahu. We're gonna be there for another week and like maybe 7 days or so. And Monica and I, we got rid of all of our debt so that we can live our life like this. Anyway, let me know what kind of videos you guys want me to make and I'll try to address them in future videos. All right, see you guys.